Hey folks, today we're going to be interviewing Dr. Amir Ramezani on the topic of what is self-compassion. Let's roll it. So, please welcome Dr. Ramezani. Dr. Ramezani, it's a pleasure to have you on Mindfulness, our YouTube channel here.
Yes, it's a pleasure to be here with you, and I'm so glad we're able to have this discussion together. Yeah, it's been um, such a wonderful experience, just going back and forth. Me and you have so much in common, so
We do, absolutely. So let's start with introductions so people know who you are. And just to let the viewers know, we will have some information about Dr. Ramezani, his recommendations, and I think you'll be providing us some resources. Is that correct?
yes, yeah. At the end, I'll provide you with some resources.
Great, great. Thank you. So, how about we do the introductions? Tell us a little bit because Dr. Ramazani is one of those very bright but humble individuals. So, he wears many hats and he has a private practice, a consulting company, and would love to hear a little bit about it. Could you let our viewers know a little bit about yourself, please?
Sure, yeah. So I'm a psychologist, and I have a private practice at the Center for Cognition and Compassion, where I provide consultations, evaluations, and also meditation training, which I really like myself. I
Mm-hmm.
personally do, and then I also, yeah, like you said, I do wear different hats. I also work at the University of California, where I also practice and I also teach. Um, and yeah, I think that's
Wow, that's it. I think it's a little bit more than that's it. That's a lot of hats. But and by the way, we'll also put your website down. Could you just verbally tell us what is your website?
sure. Yeah, my private practice website is dramirramezani.com, and that's where I have most of my services and trainings.
Okay, very good. We'll put that up in the resource page in the show more section of this channel. So thank you. Let's hop right into it. I'm kind of eager. I'm getting kind of anxious to ask you all these questions. So with that said, I think one of the things that will help our viewers is to start with a definition. Can you tell us a little bit about what is self-compassion? Because sometimes when we think of compassion, we think of like Mother Teresa doing for others, right?
Mhm.
And so I guess I have a question. I think I'm sure my viewers will too. Is what is the definition of self-compassion? You know, how is it different from maybe sympathy, empathy, or even just kindness for that matter? Could we start there, please?
Sure. Yeah. 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 And I think there's so many assumptions that we can make, especially when it comes to around self-compassion.
Mm-hmm.
Self-compassion is bringing kindness, which we all have the ability to do, to a part of us that's experiencing some sort of suffering. That's self-compassion, really. And there's many other ideas around it, but that's the key element. And it's different from empathy in that in empathy, we're feeling another person's suffering
Mm.
versus compassion. We're feeling it, and then there's a giving of kindness to that.
Wow. Wow, that's a big difference because I think when we hear sorry to interrupt you there, but that is a really powerful thing. It's almost like we identify someone kind of suffering and we want to kind of do something about it. I mean that's really a huge difference, isn't it?
It really is because when we're holding so many feelings, whether if it's the feelings of ourselves that's going through the suffering or the feeling of someone else's, when
Hmm.
we're empathizing, that takes up a lot of mental space, and sometimes we can feel that, and so there's this idea of like what was referred to as passion fatigue, but really now we understand it as being more of empathy fatigue,
Oh,
resonating so much with other people's feelings. But then when we go to the next step of not just holding someone's feelings or our own feelings as for some sort of suffering,
yeah.
and we go into that next step of giving kindness to that emotion or that suffering, then we feel energized. So that
Mm.
is a very important part. And uh, you know, and it's a beautiful thing because it does free up a lot of mental space as well. I think in my own practice, at least that's what
Gotcha.
I.
Okay, so it sounds like this is very different, and it sounds like it would be not just helpful for the public, but also for therapists and healthcare providers. You know, we've got this COVID stuff going on, this pandemic, and I hear a lot of providers who feel so bad that when they have a patient who passes away or someone who really is hospitalized and just suffering, it sounds like this is a very important, the self-compassion part, if I heard you correctly, is very different from empathy in that you're not just all the energy is not out there. It's almost like you are having some healthy boundaries. You're taking care of yourself, yet at the same time you're calling to action to do something to help someone. Did I get that right? Is that somewhere close in that range?
And I'm so glad you said it that way too, because you're really highlighting the fact that in self-compassion, we are, you know, a lot of us were very, we're used to giving kindness and compassion to other people, but in self-compassion, we're doing both. We're actually giving ourselves kindness and compassion for being in the situation that's very difficult and the other person at the same time, which sort of I think a new idea, at least, and both I think for I think a lot of therapists are used to this idea of this dialect, how we can have both things all at once, um, and but at the same time, actually doing it and practicing it is a very different thing. So so I think it's a timely topic because, or not even topic, a timely I think skill and way of relating to ourselves and other people because we're all under a lot of serious distress right now.
Yeah.
So yeah.
Yeah, I think that's fantastic, and it's a nice reminder for all healthcare providers and people alike to really take care of themselves. You know, in a couple of weeks, I'm going to have the world famous Stephen Porges, Dr. Porges.
Yes, I can't wait to see that.
And Dr. Porges is very big on, you know, he's the creator of the polyvagal theory. And I love the word he uses about something called retuning the nervous system. And it seems like self compassion helps retune the nervous system. And where I'm going with this comment is that I'd like to get into my next question, if you don't mind. Can you share with us what is the scientific evidence? I'm a practitioner of scientific evidence practices. So could you tell the viewers, is this backed by science or is this foo-foo stuff?
Well, very good question. You know, it is backed by science. That's the short answer. And there's a lot of studies that have been done on how what happens to individuals when they go through some sort of formal compassion training. There's many different types of formal compassion training. And you know, for example, there's been a randomized control trial of doing mindful self-compassion and seeing how people respond. But overall, the majority of the literature, scientific literature, shows that that the practice of self-compassion, the practice of compassion, in and of itself, does it makes changes at a core, deeper level. So when someone is suffering, we may be experiencing stress, depression, anxiety at the surface, but at a deeper level, we're actually learning in self-compassion to relate to suffering in a new way, in a way that we have the ability to actually give kindness and healing. And I think it's such a um, you know, there's these sort of newer terms, but what we refer to as transdiagnostic, or it sort of runs across. It just this ability runs across a common way of just relating to any sort of suffering. So the scientific evidence also shows that this decreases depression, anxiety. It helps with chronic conditions like chronic pain. The studies are not just with self-compassion, but they're also with majority of mindfulness-based interventions like mindfulness-based cognitive therapy, MBSR, which is stress reduction program, that also allow for compassion to rise involuntarily. So there's different ways of doing it. There's a formal way of actually approaching self-compassion, doing a formal practice way, which I'm excited to do today. And there's these other ways where simply being in a meditative state, there could be grounds for these healing emotions to rise, like compassion, kindness, gratitude.
You know what's really interesting what you just said is this. I think, correct me if I'm wrong here, Dr. Christopher Germer is one of your mentors for self-compassion. Is that correct?
I trained with him, and I'm also on a committee, diversity and equity committee, I learned from him, and actually really it's a big community of people.
What's really interesting is that I briefly chatted with him a while back, and I like what he said about this, which ties into what you said. He says, because I'm a pain psychologist by training, that's my specialty, as you know, and I love what he said about that. There are studies coming out showing that self-compassion helps reduce the stigmatization of people with chronic pain. What are your thoughts about that?
I think it's very powerful for chronic pain, just because there's so many different elements with chronic pain. Like you said, there's this destigmatization. There's this also, there are these core experiences that individuals have when they're experiencing a chronic condition, like not being seen, feeling invalidated by providers, messages that's been communicated to them, like it's, the pain is not real, or it's in your head. That's very toxic. And so I think, and it really questions their own sense of clarity about their own experience. And I think self-compassion really hits at the core of these challenges that folks face with chronic pain, in that the person learns this ability to really recognize this sensation, this unpleasant sensation that they're experiencing, and then they begin to interact with that sensation in a new and healthy way. And then and it sounds strange, but actually then to begin to bring some sort of giving to the sensation, which I think that's where things can transform. And I like, for example, one case that I had was, when we actually looked at that sensation, this wave of unpleasant sensation that would just rise throughout the entire body, if we were to sort of ground ourselves and be with it, the person actually found that there's a lot of grieving, and this wave that was coming at them with this unpleasant sensation was actually a gift to recognize how much this person missed their father who had passed away, and to begin to start the healing process. So it's I think I'm biased, but I think it's powerful.
I think it's and not to shy away from what you just said. I love what you just said, because as you were speaking, I was imagining you working with a patient, and just at that moment, because I've had that experience with my patients, where some of my patients have said, I just want to pair this together and then get your feedback, and I have a few other questions to ask. Hopefully we're doing well on time here. And I'd like to share this experience I've had with many of my patients. Some of my patients have had massages, and all of a sudden for example, their neck, or it's their back or their legs, and all of a sudden there's this grieving that comes over them. It sounds like what you're saying to us is that when we experience something very difficult, and an elixir, an antidote, something that soothes and bathes the nervous system, is self-compassion. Is that what you're saying, in that difficult moment where we can help someone work through the emotion as opposed to pushing back?
Yes, yeah, exactly. I think you said it so well too, in that we naturally have this aversion to unpleasant experiences in general, whether it's a sensation, an unpleasant emotion. or even an unpleasant person in our life. And so being able to approach the experience with curiosity and then to hold what is really going on emotionally with this experience, and to, the person feels comfortable enough to make the space in our minds to then give a level of kindness for that experience and ourselves at the same time, which is not easy. It's a practice. And I learned from you too, and I've heard of your cases too. And I think part of this is just the ability to stay connected with the experience, have that curiosity, someone to walk the person through. Sometimes it's not easy for the person to do these things by themselves. So when there's someone else there to help them, coach them, guide them, I think that's where major changes happen.
Thank you. That was perfect. That's beautiful the way you just said that, because I think we share some experiences of mutual clinical practice where we've helped patients kind of settle with their sensory experience. May that be the emotions, the thoughts, or the physical pain, right? One of the things that I've been experiencing also, just it's kind of nice to hear you say this, that when we help patients connect with what is difficult, when they're no longer using distraction or avoidance, it is as if what you're saying to us in that moment, we have an ability to shift something within us.
Yes, yes, exactly. And to make that shift. And I think, it's not just for the people who we're serving, but I
Hmm.
think this kind of practice, at least for me personally, it's been a way of, and of course you know this because we have, we talk, but personally, it's been a way of not just focusing in on the patient, which can be challenging for the provider, but also for the provider themselves to also have a way of relating to their own experience as they're with a client or a patient, so that they're not getting burnt out. And I think in addition to that, in my opinion, at least for me, the practice has been a way of uh, giving and sharing and receiving learning. It's like sort of not just within your own practice, but with the community that's also doing this, which I think is a powerful thing altogether. So it's like, even though it starts with like self-compassion, it really blooms into including the client, including the colleagues, the community, and so forth, which
So you're saying, so basically self-compassion has a ripple effect and impacts every domain of your life.
I believe so. That's
I'll, I'll take that and a glazed donut to go. That's fantastic. Wow. Now I'm going to ask you a tough question because you're this big brain guy and you're a neuropsychologist. You do forensic stuff. You do all about the cognition, and your private practice is called the Center for Cognition and Compassion. Did I get that right?
yes.
Okay. So here's my big tough question, Dr. Ramezani. What does brain science say about self-compassion? Whether it's the nervous system. I know I talked to you about the evidence about it, but do we have a definitive part? Is it just all the whole brain? I mean, help us understand that a little bit. What you do know, and I'm not asking you to clearly define that, but what do we know about brain science?
Yeah, definitely. And I think this is the most fascinating part about this, is that there's just been some very real and hard evidence for the impact of passion training and what the brain is doing. And I think there's just, it's very interesting because when we're approaching something that has some sort of aversion, where we just kind of don't want to approach it, naturally our nervous system is going to kick up. And one study found that, well, we talk about different kind of brain regions, but as you're aware of, and we talk about at times, is the limbic system and the amygdala that light up. Typically, they sort of, our body gets ready to kind of push back. We get really at a core, we just get scared, really. Um, but one study found that individuals who went through compassion training and they did functional MRI. functional MRI is looking at the brain in real time and engaging the brain in some sort of task so that we can see what areas are changing, what areas are not. And that's very important because what areas are changing is usually what we talk about, but areas that we are not changing is very important because I think that's where the real science comes up in the meditation and compassion training. But in this study, they looked at folks afterwards, and they noticed that the amygdala, as they're approaching some sort of suffering, for example, they're in the brain scanning machine, they see some sort of picture of suffering. As they see that, folks who had compassion training, they are more likely to look at that, one, and two, their area, the fear center, the amygdala, is not lighting up as much, which is very interesting. And then areas that are responsible for empathy and actually being able to put oneself in someone else's shoes, these are areas like the anterior cingulate, the orbital frontal cortex. There's many other areas too, but these areas were becoming a little bit more online. They're getting freed up a little bit better. So with that, the way I take this, there's many ways of interpreting this, but I think the way I see it is that after compassion training, we're not scared to approach some sort of suffering.
That's that's amazing. So I work in metaphors, you know. We've hung out long enough, and I think you know me. I work in metaphors. Let's kind of put this together so our viewers and listeners can actually really grasp what you just said a few seconds ago. It sounds like what you're saying is self-compassion training, when we practice this even as a lifestyle versus just as a skill, right? It sounds like what you're saying is our smoke detector in the middle part of our brain, the limbic system, correct me if I'm wrong here, is the emotional center, right? And so it sounds like what you're saying is one of the most primitive parts of our brain dials down, and but just as also on the opposite side is when we're not practicing self-compassion, or when we're just really caught up in misery and just reactive and negativity, and we're just fearing, I can't remember the word you used, but just really just caught up in just that deep dark reactivity. It sounds like the limbic system takes over and the front part of the brain goes offline like a Wi-Fi. But what you just said was, when we practice self-compassion, according to studies, the most primitive parts of the brain starts to deactivate or settle down, and if I heard you correctly in a metaphor that I'm using here, is your front Wi-Fi comes on. So it's almost like we're able to see with clarity. You know what? I got to share this with you if you don't mind. This is so this morning I was walking my dog, and I was kind of caught up in my head about a few things, and my dog pulled me on one corner, and it really felt like it was going to rip off my shoulders. And I basically yelled at the dog and said, "Bentley!" And so I got reactive. And in that moment, after I got reactive, I realized that in that moment, because I knew I was going to interview you, I realized at that moment it's hard for me to have self-compassion for myself, or even for my dog or anyone, when I'm activated. So you're telling us that self-compassion is not just this foo-foo softy thing where it's like you're giving up everything. No, it's about basically having some sense of healthiness, where when we practice self-compassion, we're less likely to be reactive. And even if we're reactive, as I did with myself when I got upset at myself for getting upset, I was able to say, it's okay. It's okay. And I even put my hands on my chest and just basically kind of tap myself that way. Did I do good there? What are your thoughts?
Yeah, I love that. Yeah, I think because you're really bringing everything together. You're bringing kindness with a sense of touch. You're bringing really the soothing, very caring self-talk towards yourself. You're having a bigger picture. I think this is what happens a lot of times. We have the bigger picture, and you see, oh wow, there's this situation. My arm is in pain. This maybe my dog is just wanting to do something. It doesn't have any bad intentions, and here I am. I'm also, reacting and then sort of bringing that together. And I think what you said in terms of sometimes the assumptions we make about self compassion is like, oh, is this some sort of what was the word you said? Foo foo, So
It's a clinical and technical name. Just want to let you know.
that's a good one. So, but I think sometimes I personally, at least from my practice, is that I think, and seeing other people, it takes a lot of bravery to approach something that is very scary, and and, and I think when we are able to quiet the mind and approach it with curiosity, allow it to be without trying to change anything and just trying to see what it's about, that in itself is an act of bravery. Um, and I think most people who practice this, they get immediate. Um, it's very real for them. They may not have this awakened kind of state or anything, but or some people I have had some folks actually make a major change and shift. But but whatever their experience is, they realize it is very meaningful and their own truth. Number one, number two, and but also they can now begin to relate with it and actually work with it.
That's fantastic. Sounds like this is helpful. And I do believe some of the VAs around the country are being, the veterans are being taught self-compassion, mindfulness, meditations, practices, anything to do with self-compassion, because they really do need it, both the men and women coming back. And also not just the military people who serve us, but also one of the most important things is that people who are struggling and children because of this COVID, and it sounds like it's a perfect time for us to practice that.
I agree. It's perfect time, and it's also, rather than doing a practice that's draining, although sometimes some things may come up, and that is it in itself. It does consume energy, but at least from my understanding and my experience, is that most folks, there's a level of energizing that comes with it. So I think, especially in a time where we're,
I will tell you this is I want to thank you personally, but before we go, I wanted to say this, and then I was wondering whether you can walk us through, if you could give us maybe a few tips and maybe like with our eyes open when we're not on the cushion, how to be kind to ourselves, things we could say to ourselves, and then it would really be an honor if you could do a meditation for us, a self-compassion meditation. And I think it's important for us. I think very often when we talk about topics like this, that's just great. It's nice to put it into practice. So with that said, I do want to make sure I personally thank you. I thought I knew about self-compassion. I even told Dr. Germer this. I said, since I met Dr. Ramezani, I said like, I know about self-compassion, I know about compassion. We all know about compassion. Tell you the truth, I did not know about compassion. And after you let me borrow Dr. Chris Germer's book, which was very mind-blowing, I was blown away by it. And we'll put that in the resource page in the Show More section with some book recommendations that you'll provide us that will give the viewers, and maybe even a website or two. I think it'll be good to have that. But I just wanted to personally thank you for introducing that. And it's become a lifestyle and a practice because I really don't enjoy being harsh with myself, and I've learned something interesting. As you said, it's sort of impacted every aspect, even how I care for my patients or children and family members, friends. But most importantly, I've noticed that I'm able to see, I think I love what you said, practicing self-compassion has given me some sense of clarity to step back and to see things even not as they are, as I'd like it. However, I'm able to connect. And that's something I really was amazed with. When you have self-compassion, it's almost like you can walk through a fire, as opposed to complain about, it's so hot today, or why isn't life going the way it is. It's almost like there's a protection around you. Then you're able to not lose yourself, but give a piece of yourself, but also one to yourself, to others, and self. So big thank you on that. And what do you say we roll into a meditation? What are your thoughts about that? Are you prepped for it? Are you ready for it? Any tips? And then we could do the meditation. What are your thoughts about that?
yeah, that sounds great. Yeah, so I'm happy to do it. Yes. Yes. So as we walk through this practice, um, we'll take just only a few minutes. I want you to just first take a moment and just ask yourself, how do I usually relate with a loved one who may be experiencing some sort of mild stress in their life? How do I typically relate with a loved one? And this doesn't have to be a person. It could be an animal. It could even be imaginary, or it could be a very real spiritual figure. So any sort of figure that's a loved one that you dearly love, and just really asking yourself, how do I, if this figure, person, or animal was in some sort of mild stress, how would I care for this person? Take a mental note of that.
We'll be doing a self-compassion practice today. The type of practice that we'll be doing is a kindness towards the self practice. And for this practice, it's helpful to really know how you already give kindness towards others. So it's helpful to think about a loved one, someone who you love unconditionally. This could be a child, this could be a pet, it could be really anyone who you really care about. And just ask yourself, if this person was in some sort of stress, how would I show my kindness and my caring towards this person? What are some words I may use when this person is not feeling well? What are some gestures I may show to communicate that I really care for this person? And what's the tone that I would use in my voice and my general demeanor towards this person? And just take a mental note of how you would show your kindness towards this loved one. And now, let's go ahead and start the practice. So if you like, you can either close your eyes, or you could keep your eyes open and just stare at a spot. And feel free to bring your attention to the sensations of your breath. And just notice these sensations in your breath in a non-judgmental way, in a kind way. And maybe even noticing the sensations of the breath with a sense of curiosity. And you don't have to really change anything in your breath. You're just bringing your attention to how it feels and the sensations of it. So maybe the rise and fall of your belly, or just noticing how the air feels as you breathe in and out through your nose. And now allowing your breath to become the background. And bringing to mind yourself in a time of feeling mild stress. Maybe a period where things didn't go as you wanted them to go, and you were just not feeling that great. And now just noticing how that may feel in your body. You may feel it, for example, in your chest, or maybe even feeling it in your abdomen, stomach, or your throat. And just noticing that sensation in a non-judgmental way. And just allowing yourself to be with this sensation. And just knowing that this is a part of you that may not be feeling so great. And that's okay. And just as you would treat a loved one, bringing that same level of kindness towards this sensation in your body. Maybe using the same words, maybe even mentally giving the same gestures, or even giving a soothing touch. Maybe even talking towards the sensation with the same tone that you would use for a loved one. And now allowing yourself to fully experience this self-kindness. And now allowing this to become the background. And bringing your attention to the sensations of your breath. And when you're ready, we can slowly return back and open our eyes.
That was good. Thank you. That was good. All right. Wow.
Yeah, and you know, as we do this, there could be so many things that can come up in our experience, and you know, I think there's a lot of times good information that comes up. It could be sometimes not easy to work with some experiences that we have, but I think at the heart of this, it's good material to process and think about.
Gotcha.
For some people, you know, this is a meditation exercise, and so, but for some people, they can have, you know, they can have a lot of realizations about how they're relating with themselves. They can have sometimes other information that comes up and interrupts their experience. I think that's very important to be aware of.
Do you mind if I ask you a question and then we'll wrap up here and we'll make sure we get the viewers the information and anything useful with self-compassion and including the meditation. Let me ask you this question as we come to a wrap here. I have a lot of patients who have chronic pain and trauma, and they go hand in hand sometimes. And so I have many patients who are not trauma informed or polyvagal informed, which we'll talk in another video. But I wanted to get your confirmation on this. So many of my patients who actually have severe trauma, when they do meditations, I think sometimes therapists, psychologists, practitioners forget to discuss what to do, and if they do experience a flooding or numbness, do you have any recommendations that come to mind?
Yes, yeah, and it's very normal for sometimes traumatic memories to come up, especially when we're doing any meditation. And, and this is really coming from a place of really from a wellness place. I think any time where we're not feeling well within it, and other traumatic memories come up, I think it's helpful for us to redirect our attention back to our breath, to have some sort of grounded experience. Because in that moment, our mind is not here with for example, the compassion practice or the meditation practice. Our mind really drifts back into the past, and then it's as if we're in the past. We're no longer here, watching this video or this podcast. So what we have to do is we have to bring ourselves back into the present by reconnecting with our breath, or just simply something like the weight of our body in the chair, or the weight of our feet on the ground, to give ourselves a feeling of being grounded and centered. I think that's
so it sounds like you're saying then to us that when you do experience that, it's good to ground yourself back into the present moment. And would you recommend someone who's experienced that flooding, and as they're doing that, to have compassion on themselves, maybe say a sentence that's kind they would say to a loved one, to settle down? And do you have them open their eyes at that point? Do you think that would be helpful?
Yes, I do. Some people need more of really like some sort of activity to feel grounded, maybe opening their eyes, engaging in an activity. And some folks may need to simply continue with that exercise, and like you said, giving themselves a moment of compassion for just simply experiencing this memory from the past that comes up. And I think that's a very important thing, just to say to ourselves, gosh, right now I'm suffering right now. And this is a moment of kindness that I can give to myself for having this experience.
Great. Thank you so much. It's been a pleasure having you, my good friend and colleague. So, Dr. Ramezani, it's a true pleasure. Thank you for taking time off on your busy schedule. I know you're very, very busy. And by the way, I love your office. It's gorgeous. It's absolutely great. So, it's wonderful. And for the viewers here, we will be, in the next few weeks, we will have Dr. Stephen Porges on, and we'll be talking about the polyvagal theory. And if you don't know what the polyvagal theory is, you will surely soon be caught up with the polyvagal theory and how important it is to our wellness, our health. Until then, it's a true pleasure serving you. I'm Dr. Les, and I'll catch you the next moment.